of the toenail grows down and in. Our patient is ready, so let's begin by disinfecting. First, our patient is ready, so let's begin by disinfecting the toe. Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe. Great! Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail. First, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail. Great! Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection out as you can. That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up. Finish by applying some antibiotic ointment on. Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some. And that's how we remove an ingrown toenail. You did a great job today.
Welcome to Surgery Squad's virtual erupted wisdom. A wisdom tooth, X-rays, or the two most common wisdom teeth. First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator. Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed. Now clean the area using a surgical suction. This will allow us to check the area for Everything looks great, but we're not done yet. Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot. Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth. When getting wisdom teeth removed, it's important to remember, and that's a wisdom tooth extraction. You did great. If you're up to it, why not try? Welcome to Surgery Squad's virtual laparoscopic RNY gastric bypass surgery. I'm Dr. Jeff, and I'll be your guide for this procedure. Are you ready? Let's scrub in. Gastric bypass surgery is designed to assist an obese patient in weight control. In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine. There are several common types of gastric bypass surgeries. We've recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into shape in about 5 minutes. Our patient has been prepared for the procedure with a mild sedative. From here, we'll place an endotracheal tube down the patient is ready to go. Now we can begin our lap. Next, we'll place a device called a trocar into each incision. These devices allow us to easily slide the instruments into the abdomen. Some of the instruments we'll use include a light and a camera, so we can see what we're doing on a video monitor, as well as the surgical instruments, such as the stapler. Now, to give us plenty of room to work, we fill the abdomen with carbon dioxide. Let's face it, with a newbie helping out, we'll need all the room we can get. Time to start the gastric bypass. We'll use this monitor here to see our work. In RNY gastric bypass, we eliminate up to 90% of the stomach by making the patient's stomach the size of an egg. We do this by first placing a line of staples that separate the smaller new stomach from the whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation. Click the stapler where indicated to create the new stomach pouch. We'll now separate the small intestine from the old stomach, about 2 feet down. The lower part of the intestine will be connected to the new, smaller stomach with a 1/2-inch opening between the stomach and the intestine. It's kind of like rerouting traffic on the 405. Use the electrocautery device to create a 1/2-inch opening where indicated in the new. Now, drag the loose end of the intestine to the new stomach pouch to attach it. I'll add some sutures to hold it all in place. Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the free end of intestine attached to the old stomach over to the spot on the small intestine where indicated. Again, I'll suture it all into place. The new smaller stomach pouch was created. Everything has been reattached, and we checked for any. Now our patient. You've been a great help.